Hi guys, today we will study about chronic bronchitis with case study so we can learn effectively. Now, first I will show you the case and we'll discuss about it, and then we will talk about the chronic bronchitis. Now, the case in front of us is about a patient that is 62 years old and is an auto mechanic, and he's suffering from progressive shortness of breath for the past several days. His problem began 4 days ago and he said that I got a cold, and his cold consists of sore throat, rhinorrhea and myalgia. His job forces him to work in the cold and damp air. At first he just felt tired, but later he developed a cough and shortness of breath. Initially the cough was dry, but within 24 hours out of onset it produced abundant yellowish green sputum. He said I cough up a cup of this stuff every day. He didn't think much of the cough because he continually coughed during the winter of each year. And his wife stated that he spits up every morning when he gets up from bed. The shortness of breath has worsened so that he can hardly speak now. He also has pain in the left side of the chest. When he coughs, he becomes very tired after walking up a flight of stairs or during a coughing spell. Mr. Cora has been treated for high blood pressure, pneumonias and infections of his hands. He has been treated for similar episodes of coughing and shortness of breath during the past 2 years. Once he was hospitalized because I was drinking too much and my pancreas acted up. He smokes 1 to 2 packs of cigarettes per day and has done so far the past 35 years. So, and this is the history of your patient, and you can note many important things here. That he is suffering right now from sore throat, rhinorrhea and myalgia, and he coughing a lot of sputum. So, which is indicating that he has a high number of goblet cells which are producing a lot of sputum. Now, and it's also very important to know that he is a cigarette smoker for past 35 years. That increases the chances of being a COPD patient. Now, also, he is treated for similar condition for past 2 years. And he was also applied because he was drinking, and he was also a drinker as well. So now what you get by the history, that he is suffering from persistent coughing during the past 2 years and with the sputum, which is the definition of your chronic bronchitis. Now you also can see that he is getting really tired quickly, which is showing that his blood is not oxygenated well. And if we look at the ABGs that are given in the history, you can see that his oxygen saturation is way below normal and the carbon dioxide saturation is above the normal, which is showing that why he is tired, now by the history you can easily tell that it is a case of your chronic bronchitis. So how you will treat your chronic bronchitis? One is your steroids. Steroids can actually inhaled, and they relieve your symptoms of your chronic bronchitis because they decrease your inflammation. You can use antibiotics that fight the respiratory infections that are common in your chronic bronchitis patients. You can give vaccines for pneumonia, oxygen therapy, because as you can see, the patient cannot breathe properly and they need something, device or something that provide the oxygen, aid them in their breathing. Now you can also do surgery, and these surgery include your lung volume reduction surgery, in which your small wedges of damaged lung tissue are removed, and it is recommended for some patients that are suffering from chronic bronchitis. We will say to the patient that you should stop smoking, and because the smoking is actually the causing factors of the increase of goblet cells in your respiratory tract. Now, classic symptoms of your chronic bronchitis include your frequent coughing and a cough that produces a lot of mucus, wheezing, whistling or squeaking sound when you breathe, shortness of breath, and especially during physical activity, and also tightness of the chest. Now, what is the pathogenesis of the disease? as you already know that smokers have a greater number of goblet cells in their peripheral airways, which increases the potential of mucus in the lungs. And the number of small airways that are blocked by the mucus increases with the severity of the disease. Now, the increase of neutrophils and the peribronchial distribution of fibrotic changes actually results from the action of interleukin-8, colony-stimulatory factors, and other chemotactic and pro-inflammatory cytokines. Now, airway epithelial cells release these your inflammatory mediators in response to some toxic, infectious, or inflammatory stimuli. So that is it for this video, and I hope you liked it. Thanks for watching.